of Love, The Crisis of Care, which is Madeleine Bunting's new book, published last week. And I want to just thank you all so much for coming to celebrate it. It's really great to have you all here, albeit virtually. And among us are not only family and friends, but also many of the people who Madeleine spoke to while writing this book. So it's wonderful that you could all join us tonight. I'm Bella, I'm Madeleine's editor at Granta. And for this launch party, first of all, I will say a few words. Then Madeleine's going to introduce the themes of the book. And then we'll hear from 4 of Madeleine's friends who've written about or been involved in care-related work. And they're going to reflect on aspects of the book or ideas about care which particularly resonate with them. And then there'll be a chance for your questions. And if a question or comment comes to mind during these proceedings, please will you write it in the chat box? And then we'll turn to the questions when the speakers have finished. And if you could keep your microphones muted unless you're speaking, that would be really helpful. So Labours of Love has been long in the making, and it's an extraordinary labour of love in itself. Madeleine's been interested in the subject for years, and I first heard about her inquiry 4 years ago when she was writing a series of essays for Radio 3 about the subject of care. And she'd already done a huge amount of research for those essays. And I think Madeleine understood something then which has become particularly urgent in this COVID year, which is that care is the glue of our society, and that it equips us to face the challenges of life, of suffering and of death, but that its systems and its language have been really seriously degraded. And to explore care, she has gone far and wide. She has been into care homes, into doctors' surgeries, into charities. She's spoken to social workers. She's been to end of care hospices. I think what she found out is often shocking. Care work is undervalued by government and by society. It's squeezed by cuts. It's mostly work done by women, and much of it is underpaid or not paid. And it's an invisible issue, rarely addressed in its range or its nuance. But set against this is the compassion and kindness that course through the acts of caring done by professions or done by individuals. And the book introduces us to the language of care that rarely makes it into policy. So words such as pity or sympathy or empathy or dependence, suffering and kindness. We come to understand, reading the book, that transformative, loving, relation-based care, which Madeleine has captured so movingly, is an essential part of the human condition. Labours of Love has been longlisted for the Baillie Gifford Prize, which is really wonderful news, and we're going to hear about whether it's made the shortlist next week. Endorsers have already called it a masterpiece, essential, profound, a book which cannot be ignored and compulsory reading. And glowing first reviews are just in. It moved the Observer reviewer to tears. And we're going to see many more reviews over the next month. Madeleine is going to be appearing in festivals. She'll be doing some local TV. She's on Start the Week on Monday. So this book is really hitting home at a pivotal society and political moment. And it's a vital book for our times. I think it's the starting point for a national conversation about the importance of care, which is long overdue. So I just really want to say congratulations, Madeleine, on this wonderful, timely and moving book. And I'm going to pass over to you now to introduce the book and some of its themes.
Bella, thank you so much. And thank you so much to everybody for coming. It's really, really moving to see so many participants. I think we're heading to something like 100 people, and I can see so many little faces of people that I love and really, really cherish. And I really love these opportunities at book launches to say thank you, because as ever, my books are always fed by friendship. And this book, like no other, because so many of you that are on this Zoom have helped in one way or another. And sometimes you're aware of that and sometimes you're not. Some of you have very patiently put up with interviews. Others have been such an inspiration along the journey. So a huge, huge thank you. And some of you our interviewees or people that helped arrange interviews, or very, very bravely opened up your organisations so that I could shadow you in your work of care. And I'm so deeply grateful. This book couldn't have been written without the help and support of so many people. And then I just want to mention two names. It's always a long list of names, but there are two women that have been absolutely unflagging in their support for the book. And there are definitely moments when I doubted exactly how I could do this book and whether it would ever see the light of day. So I really want to say a big, big heartfelt thank you to my wonderful agent, Sarah, who picks me up and keeps me going and is an incalculable support. And to Bella, whose enthusiasm is just a source of tremendous kind of encouragement and energy and has spurred me on repeatedly. So I'm deeply grateful to both of them. I'm going to be quite brief because I've got some lovely, lovely friends who have very, very kindly set aside a tiny bit of time this evening to just talk a little bit about some of the ways they read the book. But I'm just going to sort of say a few things. One is that, as Bella says, I started with this one word. You know, care is a short word. And given that I'm a writer, I'm obviously interested in words. And I just began to feel you could see the word everywhere. So many adverts use the word care. Annoyingly, even Wizz Air, the rubbish airline, uses it. Care more, live more, be more. I'm not quite sure what they mean. And yet it's still the word that we use for really intimate and extremely important relationships around vulnerability and dependence. So I couldn't understand this kind of stretch, this short word that has to cover such different things. So I started interviewing people, and I crisscrossed the country, and many of you, I stayed the night with you, or I asked you to help me. And I asked all sorts of people whose work is care, and I said to them, what is it that you do, and why do you do it, and what do you understand by care? And as Bella has described, I wanted to hear the whole range of people whose lives and work are dominated by care, from high status directors of nursing and professors through to social care workers who are paid so appallingly. And so many of the interviews started hesitantly, but when people weren't quite sure what to say or how to say it, they weren't quite sure how to explain care. And then an hour later, we'd both be astonished at how time had fled, and they would be astonished. The care workers I spoke to had no idea they could say so much. And it was so moving what they had to say. Their passion and their insight took me aback. And I felt that these people I were interviewing held to values which are so often at odds with a wider society, with the organisations that they work in. The healthcare worker who told me that the hospital management felt it was all a business, and yet she was helping an elderly patient wash themselves. She said it can't be a business, it's not a business. Or the care worker who didn't have time to have a cup of tea with someone, and she knew they wouldn't see another person that day. And even the professionals who have the status, who have the pay, would say to me they feel utterly beleaguered. They're fighting a battle, and on every front they're being undermined. The relationship, which they believed was absolutely at the heart of care, was being pushed to the side by a sort of tick box culture in which care was simply a matter of making sure that you did the right actions at the right time, a kind of routinization. So my argument in the book was that there was a crisis in care before COVID. And COVID, of course, has exposed this very dramatically to us. But there was deep underlying problems. And they were partly about money, but they were partly about our fundamental misunderstanding or lack of understanding about what care actually is. So that sent me off, of course, into the libraries, reading the history and the philosophy of care. And of course, you know, in some ways it's obvious, you know, we haven't understood what care is because care has been women's work. It doesn't require any more interest than that. And I had a wonderful moment when I went to interview Anne-Marie Rafferty, who's now president of the Royal College of Nursing, and she said she'd be joining us tonight. She said, care is like dark matter. It makes up 80% of the universe, and yet we don't really fully know what it is. Care straddles all of our categories of thought. It's a craft, an art, a clinical competence. It requires routines. It requires spontaneity. It requires real skill and competence and knowledge, and it requires deep emotional insight and wisdom. it entails both an intention, you've got to care about something, but you also have to care for someone. So it's fundamentally based in actions. Professor of nursing Alison Leary had a great way of saying it. You know, I was feeling so confused when I went to see her for coffee, and, you know, head in my hands, and she's a mathematician and a former engineer before she became a nurse. And she laughingly said to me, "It's complexity theory, Madeleine. That's the only way to understand care." So if there is one ambition that I have for this book, it's this, that we recognize the historic invisibility of care, and that we become curious, so that we look deeply into what care is, and we begin to recognize how it can be the making of the most fundamentally important and meaningful connections in our lives. And I believe that kind of sort of paradigm shift, if you like, is what might shift the political stalemate that we've reached. Because our newspapers and our media are full of the commissions of inquiry and the laments about the shortcomings of social care or childcare, this botched infrastructure of care, the care economy that we have created over the last few decades. So that's my hope for the book, curiosity.
Thank you, Madeleine. It's such a sort of clarion call, and it's great to hear you talk about the book, which is the beginning of this process of hearing you talk about the book, which I've obviously been so engaged in as you write it, but it's wonderful to hear you put it into words. So first of all, we're now going to turn to 4 of Madeleine's friends who reflect on the themes in the book. They're each going to speak for around 4 minutes. And we're first going to hear from Aditya Chakrabortty, who's a columnist for The Guardian. He's written columns about the impact of COVID on care, including a deeply moving one about his mother's death in April. So, Aditya, it'd be great to hear from you.
Thank you. I was really struck by this book, and I'm really glad to be able to speak here because I worked opposite Madeleine for a number of years at The Guardian, and I'm still rather sad I don't get to sit opposite her. There's a word that Madeleine used just then, and which recurs through the opening of the book, which I want to just kind of use in my allotted time. She talks about the invisibility of care, and I think that is a really good way to think about some of what's gone wrong in the care system. Earlier this summer, before this second wave that we're now entering into, I talked to 5 care workers at great length about one particular issue, which has barely come up in the press, but you will see as I speak the importance of it. It's about sick pay and what goes wrong when they are judged to be ill with COVID symptoms. Now, right at the start of the pandemic in March, all NHS staff, including temporary agency staff who work for the NHS, were given full sick pay, occupational sick pay, which meant that if they were judged to be sick, they could go off work and they would suffer no loss of earnings. There was no such protection for care workers. So you're talking about something like 2 million people who work in either the home care sector or care homes who were not given this protection. And the implications of that, I think, are reasonably straightforward, but I'll give you one very graphic example. I was talking to a care worker who does double-handed shifts, so works one-on-one with another care worker on a particular patient. And she told me that this thing about the lack of earnings they would suffer meant that her partner did not started to cough, have a fever, but kept on working. And she saw her at the bus stop. These are people who go into people's homes to give care to, in this case, a really sick patient. She saw her at the bus stop after she had not seen her for some time. She said, "Did you keep working?" And she said, "Yes." And she says, "But one of my patients didn't make it." And the implication that the lady I was talking to, took from that was that she kept working because she didn't want to lose earnings. And the result of that was that she passed on the virus to people who were significantly worse health than her, and one of them passed away. If you are a care worker and you do have COVID symptoms, you get £95.85 as statutory sick pay. You're not entitled to anything more legally. The Health Secretary, Matt Hancock, said on the BBC at the start of the pandemic that he couldn't afford to live on that, and he wouldn't expect to live on that. Yet he expects something like 2 million care workers to do that. The invisibility point, I think, comes in really sharply when you think about the kind of people who work in the care sector that Madeleine's alluded to in her opening remarks. In London, 2 in 3 care workers are Black or minority ethnic. In the UK, 3 out of 4 care workers are women. It's a workforce that is almost completely ununionised and suffers from a complete lack of power in relation to their employers. So there were other care workers I talked to who complained about the lack of PPE they had at their care homes. One wrote a very polite email to her care home pointing out there was 1 mask to be shared among 3 carers. She was told there were no more shifts for her after sending that email. There was another care worker I spoke to who, 2 care workers I spoke to who did go sick and went on to statutory sick pay of £95.85 for 2 weeks. The result was that they landed up in debt for going sick and doing the right thing. We are 7 months into the pandemic. We're going into a second wave. The very invisibility of the care workers, as opposed to NHS staff, means that this issue, statutory sick pay, this particular technical sounding point, which actually has a huge impact on the rest of the population, still has not been addressed. So that you could very well be going into winter in which your loved ones, your grandma, your mother, you yourself could be attended to by someone in whose financial interests it is not served for them to do the right thing and go sick when they themselves are sick. That's what I wanted to say.
Madeleine, before I move to Mariana, I don't know if you want to talk with Aditya at all about that point. I know Mariana has to leave, so maybe we should move.
I think we should, because I know Mariana's under a lot of time pressure, but thank you so much, Aditya, for that really, really important point.
Oh.
So just moving to Mariana Mazzucato, she is a professor in economics at University College London, and her latest book, The Value of Everything, considers how economic value has been determined. So over to you, Mariana.
Thank you so much. And it's wonderful to be here at the party for Madeleine, and I'm very sorry I have to leave early, due actually to some work we're doing on public health, but on the other side of the world in South Africa. And I think that is the context. Everyone around the world is struggling very much underneath this terrible health pandemic, and yet we're so lost. We don't know how to navigate the system, a system that we've actually underfunded, undernourished, and underimagined. So I love, Madeleine, what you said about curiosity. You're really helping us open our hearts with empathy, but also imagine a very different future and listen to stories, deep into the stories of different types of care work, and through that actually value care in a different way. And I want to begin with that concept of value, not just because I wrote a book on value, but because we've all been, at least until recently, clapping outside of our doorsteps, the so-called essential workers or key workers, and many of these are care workers. And I've often felt uncomfortable doing so because I think it's sort of an insult. I mean, even though all of us individually, did it in a very genuine way, but we're definitely living in a society, as Madeleine describes, where we're not valuing those same people that were then clapping on our doorsteps. And so what does it mean to actually value this very essential work, both in the home, in care homes, in GP waiting rooms that she describes so well? I really do think it means completely reorienting our value systems, but also as an economist, our economy. Feminist economists have been writing for a very long time, and it's not rocket science. When you confuse price with value, you end up not actually valuing many activities that don't have a price. So those activities in the home, when we're taking care of children, of the elderly, of disabled people, if that is not actually being paid for in the home, we haven't actually figured out a way to value it, even in the 21st century, after all these great GDP studies, to the point that you have these completely dysfunctional situations where if you marry your babysitter, GDP will go down, so do not do it, right? So work that was being paid for all of a sudden is still being done, but not being paid for, so it goes down, for the same reason that when we pollute, GDP goes up. And so I think what's so interesting with Madeleine's work is that, you know, she doesn't just stop at the critique of the system. She brings us into the stories. In a similar way, Madeleine, I was thinking as I was reading your book of, you know, Frederick Wiseman and his documentation of public housing, of hospitals, of the welfare state. He actually had, you know, films called Welfare, Public Housing, Hospital, and that documentation of the problems, but with a strong empathetic eye, but also literally documenting it as a documentary maker. By the way, I got involved, I mean, I first met Madeleine, and Madeleine probably doesn't remember this because it was an email. I think email had just come out then. We weren't all emailing each other at the time. In the year 2000, when you were running through The Guardian, I think, the campaign for the living wage, and actually emailed you and you said, oh yeah, come to the Walthamstow town hall. And then I looked at where Walthamstow was and it was going to take me longer than going to Paris at the time from where I lived. So we didn't meet there. I now swim with you, which is fantastic. But I think you've always had this streak in your work, which with really deep empathy of the problems and people and talking and, you know, storytelling, a lot of storytelling, but at the same time you're documenting and denouncing and wanting change. And there's so few books that do that. You also did it, of course, in your recent novel, An Island Song, which I absolutely loved. You know, you're reading about history and kind of documenting the history, but deep into a wonderful love story. So that ability to both document, but bring people into the deep lives of people, I think is amazing. And just lastly, because my 4 minutes are up, I really think that this clapping of essential workers and care workers, we have to make that a revolutionary act. And it can only be a revolutionary act if we really care ourselves about the people that we're clapping. And it's only through understanding and being curious, as Madeleine said, that we're going to have revolutionary change in the economy.
Thank you so much, Mariana. And it's interesting how the question always comes back to value in terms of currency, but also value in terms of status. And I know, Madeleine, you'd actually reflected on the clapping yourself in the podcast you'd recorded recently with the RSA. And I don't know whether you want to say something about clapping or your own feelings around.
Well, in a way, I think that the contributions of Mariana and Aditya have kind of beautifully juxtaposed that, because how could we clap on the doorstep at the same time as this scandal that Aditya is describing of care workers who don't have the resources or to do the job with PPE, and they don't have the sick pay to ensure that they take the safety precautions that we so badly need them to do. I mean, that's the hypocrisy of it. And of course, that goes to the heart of the problem that nursing has had to deal with for 150 years. And I know Ian Noonan is here, who's a professor of nursing at Huddersfield, and he's one of the interviewees I spoke to. But, you know, nursing has been typically regarded as the work of angels and saints. And the thing about care is it's not about angels and saints. It's about cultures which you ensure that people are properly paid, they work in well-organized teams with really effective, good, inspirational management and leadership. And, you know, somehow this kind of, but basically it's the classic assumption, which is that care must be cheap or free, and it's subsidized by the human heart. So, you know, what Aditya is describing is the pain of people who are expected to subsidize care and to keep doing their jobs out of a sense of duty and responsibility. And we're relying on those human characteristics of theirs to support this kind of tottering system. And that is sort of outrageous.
Thank you. Let's move now to Jock Encombe, who is an organisational psychologist, former chair of the NGO Mercy Corps Europe and co-founder of the Wellbeing Economy Alliance in Scotland.
Good evening, and thank you. Even though when Madeleine said, would you be up for doing an introduction, she said, look, this isn't about saying how great the book is. I'm going to say how great the book is. It's brilliant, and it's a really important book that combines head and heart in a unusually powerful and kind of Bunting-esque way. So thank you for writing it, Madeleine. Many things struck me and resonated from my own experience of caring for someone with disability and life-changing injuries, and from working for and advising charities in the sector. So a few that jump out particularly, this question actually that's come up already a few times, the question of invisibility. Why is it that what are too often, in effect, discrimination and human rights abuses that can at times verge on a form of semi-conscious eugenics, why are these not more visible, and why are they not causing more of an outcry? Perhaps, I mean, there's probably lots of reasons, but perhaps, as Madeleine suggests, it's just because they are too hard to think about. We are all, after all, if not currently disabled, only temporarily abled. And some recent research has suggested that we are unable to properly think about our own inevitable future deaths. Well, perhaps we can't think about our own probable future disabilities either. And as she so rightly points out, people receiving care are often physically or psychologically unable to advocate for themselves, while their carers are often too exhausted or too fearful of challenging the institutions that they depend on. So I hope and think that care, particularly of people with disabilities and their carers, may be coming close to a Black Lives Matters type moment. Whatever the reasons for this invisibility, there's clearly an urgent need to make the discrimination against people with disabilities and their carers properly thought about and brought into the open. Politicians, they say the right things on the whole, because that's what most politicians do, but they very, very often don't match actions with words in this area in particular. And there are a couple of live examples from Scotland where I live that are pretty harrowing, and unfortunately there are many, many more. There is not one psychiatric inpatient bed in the whole of Scotland for children with learning disabilities and or autism spectrum disorder. Not one bed in the whole of Scotland. This means that they have to travel to England for inpatient psychiatric care. This was pointed out as far back as 2001 by the Learning Disability Child and Adolescent Mental Health Service, and indeed called out in the Scottish Government's own report into the issue in 2017. But nothing's been done. We're probably talking about 10 to 20 beds needed. Nothing's been done, with significant negative outcomes for these children involving, for example, prolonged and damaging use of sedation and restraint. And for the very few children who do manage to get inpatient psychiatric beds in England, significant separation from their families with all of the problems, well-known problems that brings. Second example, 2 days ago, the Scottish Human Rights Commission, and I recommend everybody with an interest, particularly in Scotland, looks at this. 2 days ago, the Scottish Human Rights Commission published its report into the impact of COVID-19 on carers and people requiring care. Effectively, the Scottish Government's Coronavirus Act of April this year relieved local authorities of their responsibility to provide care. This led to breaches of human rights that had predictable, terrible results. For example, people having to sleep in their wheelchairs, not being able to wash or exercise, and so on and so on, with extreme negative impacts on their physical and mental well-being and on their carers. And this was done often with no notice and no communication. Finally, I'd like to say something about the question of what can be done. I suspect most people on this call wouldn't disagree with the idea that our current version of financial market-driven, consumerist, neoliberal, turbocharged capitalism needs reforming. I agree with that too. But it's also important that we're really honest about the problems with state-led solutions too. The answer is not only to give more money to the public sector and or the third sector. There are many wonderful pockets of excellence there for sure, but there are also far too many examples, in particular away from the front line, of poor governance, bureaucratic inertia and wastage, and of lack of innovation and poor leadership. So any solution has to be one that gives much more voice and power to people needing care and to their carers, and that helps the best of the private, public, and civil society sectors to work together. Thank you.
Thank you so much, Jock. I find those stories incredibly distressing to hear, but also that sort of message of hope that we might be at the point of a sort of revolution in the way we approach it it's really powerful. I'm now going to turn to Sue Stuart Smith, who I believe has just joined us. It's great you're here, Sue. She's a psychiatrist and psychotherapist and a keen gardener. And in April, she published The Well-Gardened Mind, looking at the relationship between mental health and gardening. So Sue, if you're here, over to you.
Yes, I'm here. I hope you can hear me. Anyway, like Jock, I wanted to just say at the beginning what an important book I think this is, and it is, as is being acknowledged, very timely. It's a very moving book. I found tears springing to my eyes with some of the interviews that Madeleine describes, and also what she does very skillfully is to really explore the full range of care and encompasses so many of the complex issues that underlie the issues that we're trying to explore a bit here this evening. I also found when I was reading it that my mind went back to it must have been 5 years ago, when Madeleine was just setting out on writing the talks that preceded this book for Radio 3 and the Royal Society of the Arts. And she nobbled me to have a conversation about my work as a psychiatrist and psychotherapist in relation to care. And I realised as we were talking, and I ended up saying to her, I don't think I've ever really conceptualised what I do as care. I'd understood it as a very skilled, professional occupation. I thought about my care of my children as care. And I think this is actually quite commonplace, certainly amongst doctors, where actually, because of the devaluing of care and because of the lack of status that care has, it's part of the kind of invisible nature of care. So that was very shaking up to me, actually, and I was very grateful to have that conversation. And also very much brought to mind the work that I'm currently doing, having left the NHS, with the Jock Health Service, which is affiliated to the BMA, and Madeleine's descriptions of how, I think there's a phrase she uses about the GPs, that their model of care is powerful but fragile. And I see that all the time with my colleagues in Jock Health. And, we even before the pandemic, over 30% of doctors in surveys were showing symptoms of burnout, and would have scored enough to be diagnosed with burnout. And actually, one thing I wanted to sort of flag up in relation to that is that with the pandemic, many of the doctors who were very stretched and struggling before have really risen actually to the challenges, and that's been quite rewarding, I think, to be able to sort of function as a team. It's brought people together. It's in some units, it's kind of corrected some of the sort of team working that was lacking, some of the support structures that have been lacking. But actually, one of the most distressing things for doctors are the ones who also have care responsibilities at home, particularly for elderly relatives, and that must apply for nursing staff too, is this conflict between their role, which is so important at work, and the terrible dread and fear of whether they're going to take this infection home. And I've just not seen that point being made in all the discussions of COVID and the impact of it. But actually, it's been very acute, certainly amongst my own caseload, and I think for many of my colleagues. So, and I really just wanted to end by saying, actually, I thought what Madeleine writes at the end about the circle of care is what really, really matters. And that is something, just to reflect quickly on my book, that actually that gardening does bring back into people's lives. It's a replenishing form of care. And unless, the joy and the creativity that people get from it, but also the sort of the feeling of reward, which some of your cases, Madeleine, described very beautifully, I think, that care is not only about burden, it's also very rewarding.
Thank you so much, Sue, for those comments. And in fact, all four speakers have raised such interesting points this evening. Madeleine, Would you like to sort of turn to those, or shall we open the floor, as it were, to questions at this point?
I'll just talk very briefly, because I know we're sort of running out of time. I mean, everybody's contributions have been absolutely wonderful, just what I'd hope. Thank you so much, Jock and Sue and Aditya and Mariana. I just wanted to add Sue's comment about the question, you know, when I started 5 years ago, when I asked her about care, because it was only after I published this book last weekend when something suddenly fell into place when talking with a friend, which is this book was the hardest book to write, and I lost faith in it repeatedly, and thought I just couldn't keep going. And it was a friend commented last weekend, she said, you've been affected too. So if you have a whole culture which dismisses and ignores care and devalues it, then what's the point of spending 5 years of your life thinking about this subject? And even though I was battling against that and trying to write, part of me was thinking, this is a waste of time. You haven't got time in your writing career for this, you know, and you should be doing something much more interesting. And that was often the reactions when I said to people what I was working on. Their eyes would slightly glaze over and they'd go, oh, you could see their reaction was sort of worthy but dull. Can't you think of something better to write about, Madeleine? And that affected me. And I have to say, I know Aditya's left, but he was one of the early kind of advocates. He said, no, this is really important. And so, you know, I was really grateful for that kind of encouragement. And there's many other people here tonight who've been really willing me on in all kinds of ways. And Jock was another. So, you know, we really have to fight this against this ourselves, you know, that this cultural sort of denigration of care has affected all of us. You know, kind of correcting that is a big act of sort of reimagining. But I'm really keen to hear if there's any kind of comments and questions, because I know there's loads of really, really interesting people that have joined us. Thank you so much.
I can see that Maurice Hamilton is raising his hand, so so maybe he could ask a question or a comment from Maurice.
Thank you very much, and Madeleine, thank you for writing this this very important book. I'm a professor of philosophy in Portland, Oregon, and there has been a kind of explosion of writing on care in academia across a number of different disciplines, as you know, demonstrated by Mariana's work. And what I'm excited about this book is, and what I'm hoping for, is that it can be a kind of crossover work that inspires a more general kind of commitment to think about care. A lot of the conversation here has been appropriately about healthcare and the invisibility of that kind of work. But I also worry about compartmentalizing care, and care is all of our work, and we all need to value it. And it has been undervalued, maybe largely because it's based, I mean, historically because of sexism and that kind of thing. But in the past, we've had movements. You know, we had the progressive movement in the past, and we had in the 60s, we had a love movement. I think it's time for a care movement. Jock mentioned, you know, a Black Lives Matter moment. I would love for this moment, particularly, you know, in COVID, as we're reconsidering things, to have a care movement. And I think Madeleine's work can inspire that kind of that movement where we all get involved. There's, you know, there's political philosophy being written about it, geography written about care, all of this, but it's not getting out into public discourse. And I'm hoping that that Madeleine's work can inspire some of that.
It's great to see you, Maurice. I'm so glad you could join us. And when you do get your copy, when it finally reaches Portland, you'll see that you're quoted a lot right at the beginning, that absolutely beautiful, moving anecdote of how we learn care embodied by the touch of our parents. So it was an absolutely beautiful part of your work. So thanks, and it's great to see you.
Thank you so much. And now a question from Alan Howarth, who'd like to ask Madeleine a question.
I haven't had the opportunity to read Madeleine's book yet, but I'm hugely looking forward to it. As a politician, I'd like to ask you, Madeleine, why you think politics has so abjectly failed to address itself to this challenge. There is clearly an immense social need. We talk the talk, but we don't provide the care. And there is a meanness, you've also characterized it as a hypocrisy, on the part of the state and indeed of society. So what is going on here? What is the social psychology? And what are the explanations for this systemic and cultural failure? Is it, as has been suggested a little earlier, that this is work done by women, work done by people from ethnic minorities, and their voices are not heard in politics, in public discourse as they ought to be? Is it, which is an explanation commonly given, that elected politicians are simply too scared of asking taxpayers to pay more, and in particular, to sacrifice some of the value of their homes and to reduce the inheritance that they can pass on to their children? Because home and inheritance take you into emotional territory, which is very difficult for politicians to deal with. Or is it, as you suggested at the beginning yourself, because it's almost conceptually impossible to get this right? Because care, when the language of care is not debased, we understand that care is about an intimate and indeed perhaps a spiritual phenomenon, and it cannot successfully be bureaucratized or made a matter of business procedure. And therefore, how are we to address it on the scale needed? Whether those three considerations are all partial explanations, I don't know. But what's going on? Why this block? Why can't we do it?
Well, Alan, it's a fascinating set of issues that you raise. And as somebody who has been in government, you have, I suspect, a great deal of insight to bring to bear on it. I mean, I would say that all the issues you raise are part of this, that we have bureaucratized care, and the paternalism of the welfare state has been part of the problem. The idea that we could somehow organize care from a sort of central command post. I think another aspect of it is successive waves of public sector reform were about extending sort of managerial techniques that were being used in the private sector into the public sector, which meant more audit, more regulation, and more bureaucratization. So there are many, many complex factors that come together. I am myself really not in favour of a national care service. I don't think the answer here is nationalisation. I'm with Jock on the idea that it's got to be devolved. Care is so local, it has to be local in all sorts of meaningful ways. So I'm fascinated, for example, by the Shared Lives project, where you've got lots of social care being provided through relationship. There are innovations, there are really, really exciting new ways of doing all sorts of care. So I don't think actually we lack the ideas. What we lack is the kind of vision, confidence, and the courage. And so when Jock talks about fear, I think this debate is riddled with fear. Jock's absolutely right. We're terrified of really confronting this, and I suspect the politicians are terrified of being honest and leveling with the electorate. You know, we live in a kind of mythology of consumer culture, which is constantly telling us that we can be endlessly happy providing we buy all the right things. And care actually brings you right down to the basics of human condition. And lots of people would rather not know about that. But that's a huge debate, Alan, and perhaps at some point we can come back to it. But thank you so much for coming. Bella, I think there's a few more questions, is that right?
There are more questions. Madeleine, a question from Christine Pommertz. What do you think the impact of Brexit on the care sector is or will be? And I wonder if this actually also relates to Christopher Kramer's question about, is there another form of invisibility in this, in that there's so little mention on the dependence of much of the care system on recent immigrants? And I suppose then sort of reflecting on the sort of culture of Brexit and what that means around immigration. Be interested to hear your perspective on this, Madeleine, from all your research.
Well, Chris is absolutely right about invisibility. Aditya just quoted the figure about I think it's 2/3 of all social care workers in London are BME. So we have the British culture has relied on importing care for decades. It used to be the Irish. We imported Italians, Spanish, Mediterranean cultures. In more recent decades, it's been from right across the world. And the funny thing is, certain countries get a reputation for being very good at care. So the Filipinos, for example, are used all over the world. You get global care chains whereby Filipino women leave their children behind to be cared by other people and grandparents to care for Italian children, or so forth. So there's something about the kind of British culture which has long relied on imports. Afro-Caribbean women did an enormous amount of caring, as we know in the Windrush generation. Now, Brexit is a major, major problem for care. And despite all the pressure which is being brought to bear, we know that what they're doing is proposing a system which will absolutely starve the care sector of the kind of European workers that have been propping it up. So there's a crisis brewing, and nursing is another example. We already have thousands and thousands of vacancies in nursing, and the EU has been a constant supply of nurses, and they have started to go home or to not apply to come from the minute that the Brexit vote happened in 2016. So their numbers have been dropping. And you just think, well, where is the political commitment to ensure that come January, we're not going to see even more vacancies, these people leaving or not being able to get into the country to provide the kind of work. I mean, for myself, my mother has relied on Hungarians and Spanish, and the care workers that have been looking after her, that she's formed the best relationships with, are from the EU. So it's a really, really key issue.
Okay, another question from Hilary Cottam, who would like to ask a question about the time-task dilemma. I'm not sure what that refers to. Hilary, would you?
Yes, hello, Madeleine. I am sort of almost through your book, and I just can't say how wonderful it is, how I admire your writing, and it is, as other people have said, just deeply, deeply moving. And one of the things I feel so strongly is that really, until all of us can talk about care in the way that you talk about it, it will be really hard to kind of act differently. And I think just writing and putting it out there is you've just done the most important thing, and it's just the most beautiful book. But towards the end, or about 2/3 of the way through, you talk about the task time dilemma, by which I think you mean that, as long as we value care, as long as care duties are about, what can be done in the 15 minutes, that you check in and out of somebody's home or whatever, we can't really care, because care is kairos time, it's flow time, which is so deeply challenging. We'll need just such a completely different sort of social economy, different imagining. And I just wondered if you could say something about that, and how your interviews might have led you to think about that. It's a big question, sorry.
Yeah, it is. It's a really, really big question. And actually, I sort of start thinking about that, if you remember, Hilary, about my own care. So I say that, if you spend an afternoon with a toddler, filling yogurt pots with water and pouring them back into a bowl, how do you describe the value of that time? Have you spent the afternoon doing nothing? Or have you actually been involved in a very important developmental process? And, I felt that confusion as a young mother. But it does relate to your issue, which is that there's so much about care, which is it's kind of very, very hard to describe or explain. If somebody sits down and has a cup of tea with somebody, most of us would regard that, in many circumstances when the person is elderly, living on their own, scared, as a crucial form of care. But of course, that care worker is being monitored remotely, as we know. Mm-hmm. And if they overrun their appointment, there is a question as to why they didn't, empty the waste bin, do the washing up, and make sure that their client was dressed and had a meal. I mean, all of these tasks have to be sort of tick boxed, and they all have to fit into a very, very limited amount of time. I got very interested in time because the industrial, very briefly, because this is a sort of section of history which is quite fascinating but quite complex. Industrialization introduced this concept of sort of time efficiency, that there was a certain amount of time and you had to speed that up, and taylorization was about splitting up our tasks and making sure that things were produced in the most efficient manner. And those disciplines that tried to be imposed on on care. And I think it's had disastrous consequences, because what you end up doing is the care worker who's trying to juggle her sense of duty and responsibility that took her into the job in the first place with the requirements of a manager who's saying you're going to have to leave, you can't stay, you can't actually do what you think you ought to be doing. And I think there's a kind of emotional violence actually about that, which I think is a really, really, so the care worker that I interviewed, who had worked for several different agencies, was working in a care home when I came across her. She described an incident where she was worried about abuse, that one of her clients had bruises and she didn't understand why. And she was crying as she described this to me. And it was several years after the event. And she has been carrying that pain. She said at the time she left that appointment so upset and worried, she phoned her mother. And she was West African. So she was said to me, my mother sustained me throughout all my care work. It's her inspiration that has enabled me to do that work. And it's her incredible deep compassion. So again, I thought we've imported that from another culture which does value care. And yet we still expect this young woman to sort of deal with the trauma. I mean, that's how it was a form of trauma. That several years later, she was still finding it hard to describe this incident without crying. And I think that emotional violence, and I describe it in the book. I found it so. I mean, I was crying with her. It's kind of really painful to listen to.
Yeah. I think we have time for one last question, and there is another one from Willem Kaiken. I don't know if that's how I pronounce your name, Willem. If you want to put yourself on.
Thank you, Bella. And I haven't yet received your book, Madeleine. It's arriving tomorrow, so I'm looking forward to reading it. But I always love your work, and I love hearing about your work, and the kind of sense of all of the solutions, or the analysis and the solutions being at a sort of historical and social level is very compelling. But I notice on your shelf, and I know you too, that you have an interest in how we best cultivate the human mind and the human heart. And is there more that we could be doing as parents, as teachers, as educators, to be cultivating the human mind and the human heart around care?
Oh, well, Willem, it's lovely to see you. And of course, we've had plenty of conversations about exactly this subject. And Willem is a professor at Oxford, and he runs the Oxford Mindfulness Centre. And I talk a lot about attention, about the three components of care: attention, presence, and touch. Those are kind of the sort of, the most basic. And it seems to me that I talk about mindfulness. I talk about the work of Ian McGilchrist, who's master in emissary, I think is an absolute masterpiece. And I talk about our capacity to pay attention and our capacity to be present. And I think this is where my discussion about care feeds into another huge debate around the attention economy. And, clearly it's deeply troubling when you see someone who is caring for another person and they're constantly getting distracted by their phone. Because it seems to me that how we pay attention is under siege, really, from a kind of hyper connectivity, which ironically is not deeply connected. And so how we manage to put the phone away and really sit down and be present with someone when we are needed. And we all know what that feels like when we go and visit a GP. I mean, I really, really believe every single person here will know what it's like when someone is really present and listening. And a conscientious GP is also aware of that. They know that their first task is to be fully present, so that they are absolutely listening to what the patient is saying and what the patient is not saying, is leaving out, doesn't want to discuss. So it seems to me that one of the most practical things we can do is the sort of work that you're doing, which is around opening people's minds up to this huge and crucial area about how we pay attention and how we learn to be present and to bring our minds to bear on this. So I'm glad you raised the question. I'm in fact sitting in my husband's clinic room, and I am surrounded by Buddhas, which is really handy because
Thank you, Madeleine. I feel like sadly we have to wrap up. The time has gone so quickly. It's been such a fascinating discussion and so many thought-provoking ideas, and it feels like the start of a vital conversation. I hope this is the start of the care movement. And thank you everyone for all your contributions and for all your questions. I just want to remind you that you can buy the book at a discount from Granta's website, so a bit of unashamed selling there. But also just to say that this is a vital conversation, but it is also a celebration tonight, and I just really want to congratulate Madeleine again. This is a fabulous book, and maybe we could all, I only have a glass of water, but if you have a glass of wine, will you raise your wine or your glass to Madeleine and just say congratulations to this fabulous book and to the publication of it. So thanks everyone.
Thank you.
Okay, I think it's time to go. Unless you have a last word, Madeleine.
No, well, just thank you so much, everybody, for coming. I've really, really enjoyed sort of seeing all your blurry little faces. It's such a weird experience. But I think we've managed to have some kind of conversation. And thank you so much to all my speakers. And I very much hope that I'll be continuing the conversation with many of you in the months ahead. So bye-bye.
Bye. Thank you, everyone. Bye-bye and good night. Have a good evening.